Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Welcome to Quick Questions, where we look at a question or a misconception and try to give you a brief answer. Today's question is, should you rest if you get injured? And my answer is really another question, which is, why are we still asking this question? What I thought was, years ago, this whole RICE idea, RICE, rest, ice, compression, elevation, I thought that was out the window because years later, around 2020, there were Canadian physiotherapists who published this acronym, Peace and Love. And when I saw that, I thought, all right, now we're in the right direction. Yet time and time again, I see people coming in and they have been given the advice to just rest until things get better. So my answer is that should not be what you should exclusively be doing. What you should look at is, where do you want to go? Do you want to get your function back? If you do, then I want to give you a different alternative answer, which is active recovery. Active recovery means you have to do three things. Number one, you have to understand what's the nature of the problem you have. It's hard to do that on your own, and healthcare providers, especially ERs and urgent cares, aren't always great at this. But at some point in time, you want to see somebody who has experience taking people with injuries from the beginning to the end. Get some idea of what the nature of the injury is. The second thing is, what do you do at the beginning? Yes, there may be a period of time where you're unloading a part. You notice I'm not saying lay in bed and rest. You're unloading it. You're protecting it. You're avoiding things that might cause it pain. Maybe if it's an ankle sprain, you're not putting full weight on it. And then at a period of time is the third part of it, which is how are you going to regain your function, which is you want to get it moving. You want to start putting some load on there. By load, I mean how much force are you putting on your leg? How much weight are you putting on your arm? How far are you moving the joint? And then you gradually adjust. And with the right healthcare provider, you can get back to function.
So basically you're saying that we don't have to do the RICE, you don't have to do the ice, you don't have to do the resting at all?
I want to give a disclaimer also. I'm not giving medical advice. I am giving you general information. So I'm not telling everybody, if you get hurt, hey, don't just lay there and rice it. What I'm saying, as a rule for all injuries, that should go out the window. The reason is it doesn't look at where you're trying to get to. Our body is an adaptation machine. That means what you do, it learns from that, and it does something in reaction to what you do. So if I break my elbow and I stay in a cast for 4 weeks, my muscles shut down, my joints get stiff, the healing slows down. But if I move it carefully, then the blood supply increases, the bones heal a little faster, my muscle strength improves more than where it was before, and ultimately I have a better chance of regaining the function I had before. So the point is, if you're going to shut down, unload, rest, whatever word we want to use, it has to be done in a very thoughtful way and not just as a general rule, that's it.
So basically what you're saying is, if I may, you're not doing just RICE, but RICE has a little bit of place maybe in this or early on in this, like you want to ice it maybe a little bit and keep moving.
That's right. I have no problem with using ice, but it needs to be getting you somewhere. Ice is good for pain control.
Right.
Ice is good for sometimes controlling parts of the inflammatory response, but ice alone is not the answer either.
Okay, so it's not just rest and ice and sitting there all day, but actually keep moving and trying to maintain the function of that.
Exactly. I want people to think about, where am I trying to get to from here? And if you're trying to get to something athletic or back to exercise, then the worst thing you want to do is just lay in bed and keep the part elevated and just rest.
So is there any place for rest? Like, it's not like no rest or just resting. What is the place for rest then?
I would look at it in terms of how it fits into the bigger picture. So let's just say someone who has an ACL tear. When you injure the knee, there's going to be a lot of reaction. The knee is going to swell up. It's going to hurt. In that situation, we'll usually put somebody on crutches, so you're not putting full weight on it. So you're actually adjusting the load. The load is how much weight you're putting on the knee. You could argue I'm technically resting my knee. That's really not what you're doing. You're recovering actively because you're keeping the knee moving, you're keeping some of that joint motion there, but you're offloading the part that has been badly injured, so you protect it and allow it to heal. So I like the idea of protection versus just resting.
Okay, all right. So you can't, resting is okay in between, or whatever, or to a degree, or maybe after you've done a lot of movement, just for a little bit, ice it. But then you want to make sure that you're not doing this all day. You want to make sure you're doing some kind of exercise, some kind of movement, maybe a little bit of load on that joint, right?
That's right. You want to make sure you're heading somewhere.
All right, I'm just want to make sure it makes sense to us all out here.
Absolutely.
Okay, man. Thank you very much.